I happened to be sitting in a leadership meeting 2 weeks ago, and my phone goes off, and I usually don't answer it, but this is one of those times where I'm really, really glad I answered it. A person that I knew from another community many, many years ago was driving through our town, and actually, they weren't driving through their town. A family member was driving through the town with a patient who had started to deteriorate, and they pulled into our emergency room and got the care that they needed unexpectedly with that. And that person just wanted me to know how thankful they were that we were there and helpful we were, and all of that. And so in this meeting, I'm able to then share with our leaders sitting about 3 chairs away from me and our entire leadership team, hey, we just did something awesome, and how proud of that is for me as the CEO to receive those messages on behalf of the people that did that work. And so that transparency and those connections that you've made in your communities, whether it's your current one or your previous one, I think helps to show the employees that what you do does make a difference. It is transparent, it is aware of it, and people will talk about it. And again, hopefully that's not in an ominous and scary way versus hey, we did good work and it was neat to hear about that we ended up doing those things. So I think that that's some way. And so whenever it is in a patient survey, or if I'm able to receive kudos for our organization on behalf of that, I'm always trying to share that stuff back out. And I think it brings the story full circle. I think the second way is involvement in teams. And here, previously, strategic discussions didn't include providers. It didn't include staff. It was pretty much a very administrative function. And so was one of the first things I tried to turn around was this administrative team's got lots of skills and lots of talents, but we don't know everything. We need the perspective of all these other key stakeholders in it. And so whether in developing the strategies on a very global or high level, we've involved those people, but even more so when we get into the specific tactics, like how are we going to deploy that strategy? There's frontline employees that are involved in that. So some recent conversations about obstetrical care and some things that we want to do. There's 2 OB nurses that are sitting on that tactic team, and they're helping to advise the other members of that team on how that problem is being faced currently, and what opportunities are there, and what ideas should be brainstormed around those things. I think that ties people back to it, those people that are passionate about it and want to see those solutions. And they go out and then tell the other employees, hey, I really felt like I got to contribute that information. And ultimately, when you execute on many of the ideas that are brought forward, they're like, hey, that was my idea to do that thing over there in the OB area. And then I think that just is a hamster wheel that continues to pay dividends going forward. They feel included and involved, and they feel part of the outcomes that occur.